Talk to doctors at hospitals just about anywhere in Ontario, and you'll hear similar things.
I'd say the numbers of patients that we're seeing, pediatric patients that we're seeing present at the moment has been unprecedented.
We're seeing about double the volumes through our emergency department in terms of kids with illness. Most of that's respiratory illness.
Now more than ever, we are seeing a preponderance, a disproportionate number of pediatric presentations.
Now, new numbers confirm just how bad it is. Usually at this time of year, about 800 kids show up daily at Ontario's ERs for respiratory illnesses. This past week, it's been nearly triple that, almost 2,200 a day. The number of kids sick enough to be admitted each day is also running at nearly triple the seasonal norm.
Much higher volumes and much earlier in the typical cough and cold season than I've ever experienced.
The Children's Hospital in Ottawa says it's postponing some surgeries, expanding hours of its outpatient clinics, and redeploying staff within the hospital to cope with the surge. While no province makes public as much data about ER visits and admissions as Ontario, hospitals across Canada are seeing increases too.
Right now we are very busy with admitting children with respiratory infections causing asthma or croup or something called bronchiolitis, which is also a chest infection.
Doctors say part of the problem is now that kids are no longer wearing masks like they used to. They're getting infected by viruses that they've had little exposure to since the pandemic began.
We've come through 2 years of relatively protected environments for young children, so their immunity isn't quite where it was.
Another factor, shortages of medicines like children's Tylenol. When fewer parents can bring down their child's fever at home, more end up in the ER. Now with flu and COVID-19 cases rising, doctors expect things to get worse. Mike Crawley, CBC News, Toronto.
All right, we want to pick up on this with Dr. Alan Grill. Dr. Grill, we just heard Mike talk about that children's Tylenol shortage. What can parents do if their kids are sick, but they just don't have the medication?
So the first thing that you want to do is you want to check with your local pharmacy. A lot of pharmacists are keeping children's Tylenol and children's Advil behind the counter. You can also look for other formulations like chewable tablets, or for really young kids, you can use suppositories. And often, most kids can actually use an adult dose if it's cut or crushed and put in applesauce to make it easy to swallow. But it's based on the weight of the child. So you have to speak to your local pharmacist or your primary care provider to get that advice before you use that medication.
And are there symptoms, Dr. Grill, that parents can look out for to determine, you know what, now we do have to go to the ER?
If your child is lethargic, which is they're so tired you can't actually wake them up, or they're having breathing difficulty to the point where they can't speak or they can't eat, those kids should be seen in the emergency department. But for things like fever and runny nose and cough, a lot of times those things can be dealt with your primary care provider. And if you can't get into your primary care provider, there are walk-in clinics and urgent care centers that will see you. I would also highly recommend that everybody gets their flu shot. Stay home if you're sick, and please consider wearing a mask if you're going indoors, especially if it's overcrowded and not well ventilated.
All right, Dr. Grill, thank you.
My pleasure.